Hello, I'm Dr. Lisa Wong, Acting Director of the Los Angeles County Department of Mental Health. The Department of Mental Health is committed to implementing a just culture. As you watch this video, I want to encourage you to look for just culture elements such as kindness, fairness, systems focus, respect, and listening. These elements are the foundation on which we can build a culture that is just for all.
The Department of Mental Health has worked hard to bring people with lived experience of mental health issues into the workforce by creating the Peer Advocate Program. As their roles evolved from peer advocates to community workers, so too did their responsibilities. Those responsibilities included completing treatment plans in a timely manner. In other words, paperwork.
We do have a policy here that we have to complete our, paperwork within a certain amount of time.
Employees work at a certain standard, and that's all good, and we have performance evaluations for that reason. And yet it's so easy to make that a punishment tool rather than a helping supportive tool.
I can lose notes at times. I could be entering things and then suddenly it could disappear, or like I said, freeze, or add things that maybe I didn't even put.
I had to learn how to do a treatment plan because that's part of the process. So, of course, you don't get it right the first or second time. You don't get it perfect, may I say. Third, fifth, sixth time, I say I might perfection it.
They have, lived experience, and they are engaging with our clients constantly, and they're able to provide support based on their past experience. They're able to provide the linkage and even for further empathy that they have gone through this possibly similar experience.
My family, we have an extensive mental health history, I guess you would say. My mother having schizophrenia, me having bipolar disorder. Things have become available for people with mental health issues and within DMH. And I happen to have been told about taking part in, I guess you would say, a movement, or learning how to help or be of service as a support for those who suffer from those types of things.
Over time, that role has changed, and they became community workers, which sort of changed the whole dynamic of their role. And some of that was quite challenging. Some of them didn't have, say, the computer skills that would be needed to do that job.
It's challenging. I mean, we're in the middle of a pandemic that's been going on for over 2 years now. In terms of documentation, that's always been a struggle. That's always been a very difficult a piece of my work.
The solution was to take a systems-focused approach, which is a key component of just culture. This approach provided the community workers with two things. First, training that was appropriate for their level of knowledge and experience, and second, they were given consistent and compassionate coaching as they learned and adapted to the system.
I've given Lucien credit for this. One of the things that I really liked what he did was, and this is sort of almost the opposite of me, in the sense that he depersonalized the process and said, okay, the process isn't about you, we just need to build a better process. The process is about making a system that's going to work for you, not about you, but just a process that works.
We had a 1 day a week, like not a meeting, but a sit down with him, which he will go over the notes, and like if you did a breathing technique, if you calm the person down, like we practiced that, and we learned that from actually Lucien. He did teach us that, and he did have that 1 hour sit down with us, which he would have a projector and he would show us what we need to do on a form or on case management notes or rehab notes and treatment plans.
We had kind of several sessions talking about, hey, what is documentation? What do you have to do? How do you understand the problem that client had. I mean, they simply sometimes needed the words, like, you know, depression. What does depression look like?
And if we didn't do something right in our forms or in our client or our paperwork, they make sure to tell us what went wrong. And I don't know, in a tenderness way that I can explain that I don't feel like I'm in trouble.
Lucien brings technical skills. I mean, he's computer savvy. He's licensed as a social worker. Sherwood is very much a people person. So, I mean, you know, like I said, everyone, you know, brings something different.
It was our job to sort of help them build those skills, which, you know, was challenging and fun too, and hard for them. And I, you know, I could really empathize, feeling like, well, that's not what they were hired for, so it's difficult. And yet they were very willing, and now they play a really important role.
I feel as though I am contributing or maybe helping someone who may have felt one way about something to rediscover another way of looking at things. Oftentimes just listening, being supportive, that's all it, you know, is needed to feel fulfilled.
So much of the time, you know, you have to rely on them to be willing to try, and Terry and Stephanie and Ken have just gone out of their way to really say, okay, I'm willing to try that. Let's try and see if that works. And there were many failed attempts of me saying something like, okay, let's try this as an idea. Maybe this is going to work as a way for us to get the treatment plans done. If you have an employee that's willing, you have like a gold mine, you know? So.
Like I said, my profession was business administration. It was never mental health. Now, I feel like mental health is my everything.
Our department talks a lot about just culture and being fair and being kind to each other. Our management, our clinic, and our colleagues and our staff are wanting to do that a lot because we've seen the benefit.
It's all growth, you know, but sometimes growth is hard that way. Like, can you help somebody to adapt, and can you give them enough support, and can you give them positive feedback so that they don't feel bad about their job they're doing, but also help them do a better job, right? I mean, that's just one of the challenges of the job, and I think all supervisors deal with that on every level, but I think this was a particular example of, you know, having to reach just a little bit higher.
This engagement between staff and management at Edelman Mental Health Clinic clearly shows that bidirectional communication, mutual respect, and a system focus are the key principles that make Just Culture work.
We understand that change is not always easy, but we hope this video has been helpful in showing how Just Culture can be applied when solving problems or making existing systems better. If you'd like more information about Just Culture, please reach out to your Mental Health Transformation Advocate or MHTA. On behalf of DMH Management, thank you for all the wonderful work you do.